I have basically created this presentation to explain what my approach is and how I work and why I do it that way. When we look at people that we can basically help in here, is the ones that are arriving with musculoskeletal pains. Basically, right? A patient that comes in with a history of a fall or a car accident, or one that, sits too much or too long in a poor posture or does computer work, can often find help with the office. And what I wanted to do is kind of look at why the approach is pretty helpful. And when I think about that, one of the things that comes to mind is that medically, we at this point largely deal with musculoskeletal pains from a simple symptom relief perspective. Right? We want the pain gone yesterday, and that's fine, except it doesn't usually last or solve the problem long term. And that's where we fall short. Taking a step back and looking looking at the bigger picture a little bit makes us understand that many body pains are created because the musculoskeletal system doesn't function quite properly. So the more ideal biomechanically our body functions, the less pain we have to endure.
Right.
And years of practice made me realize of how true this really is, and how profound patient suffering can be mitigated by looking at it that way. So when we go further with that, we're looking at joint alignment influences musculoskeletal function. A nice normal spinal joint complex functions better than one that is old or arthritic or injured. Global alignment and symmetry is also very important and influences the system greatly. For example, if we're standing crooked with a flat foot, with a knee bent in, or an upper thigh bone turned inward, the pelvis, if that's on one side, the pelvis will be, so to speak, crooked. And what does that do? It goes into the lumbar spine, and it then puts a shearing force onto the disc because the spine is angling down on one side. Global asymmetry can stress other body parts extra hard, distressing them and then causing pain. Correcting dysfunctional areas help us decrease the system's stress. Skeletal muscle move the body around and provide postural stability. Injury and long-term postural changes can cause spasm, creating trigger points which lead to more pain. Look at this picture down here. What do we get from sitting too long and doing computer work? We have a lot of wrist pain, we have shoulder pain, neck pain, and low back pain. Those are all very, very common. If we are putting our skeletal system into an abnormal position and leave it there for a long time, like an 8-hour workday, guess what? The joints become stiff and dysfunctional. Muscles react to protect the dysfunctional joints, and they do that via the spinal guarding reflex. Improving joint function then diminishes pain and muscle spasms. And we have a graph down here at the bottom picture that shows that it's the muscle's activity, electrical activity that shows. The more bandwidth we have, the higher the muscle is electrically fed, so the tighter it is. Right? And where the arrow is where we put in a motion-inducing procedure called an adjustment. And after that arrow, you can see how the muscle relaxes. And makes it, therefore we have much more pain mitigated from that area.